up when you're
I
ready.
did. Good morning, everyone. We are dealing with technical stuff. This is so interesting.
We are on air.
I know, but where are my pictures? Where am I? You can't see ourselves? Okay, that's cool beans. Hi, guys. Please stick with us a little bit as we get used to doing this virtual kind of thing with all the technology, et cetera. So want to welcome everyone. Thank you so much for taking the time to come on a Monday morning. We really do appreciate it. We do have people that are here both virtually, and we have people that are here in person. So it's a unique kind of experience. And usually I'm used to seeing myself somewhere so I can see how great I look, but I can't see my picture, which is okay, but it's just weird. That's why I keep looking around like, where am I? So it's all good, guys. So I do want to let you know a couple of different things when we get started here. First of all, welcome again, and that this is a new hybrid type of model that we're trying. And so you may hear boops, bings, and all kinds of fun stuff. So it'll help keep you awake, because I know beyond the fact that we have put together this really amazing. I know it is like a Jimi Hendrix concert. We have this really amazing tap dance and song ensemble that we put together for you a little bit later. However, the problem was that Lin-Manuel Miranda couldn't show up. So we decided to go ahead and just, postpone that. But I know you guys were looking so forward to being part of that. So we'll do that next year for you. There's a couple of different ways that as we go forward that you can ask questions and make comments. And those are that you can, for those of you that are virtual, there is a chat so that you can put it into the chat function. And for those of you that are live, we will be asking you just to ask questions in person. So there's a couple different ways to do that. We do have a public hearing booklet that we put into the back for those that are here, and then we also send it out to everyone who is attending virtually, so you have a copy of that. It has all the information that we're going to share, although what we're going to talk today are some of the highlights, but there's more information in there in case you need that information. We do have a short survey that we're asking everyone, both virtually and in person, to fill out at the end of the session, because we really do want your input. Part of this is not only just us telling you what's happening at the Area Agency on Aging, but also an opportunity for us to hear from you. What are some of the questions you have? What are some of the needs you see out there? And so we really do appreciate if you take the time to fill that out and to provide us with some feedback. Let me just introduce for you those of us who will be speaking this morning. So I am Kathy Bennett. I am the director of the Bucks County Area Agency on Aging. I have been in that position since October of 2017. It has been an interesting 4.5 years. Things have just been very slow and steady, no changes. It's been actually very boring. All right, that's supposed to be the cue to laugh. Thank you so much. Great. So it's been an interesting time. But I am really very fortunate to have a team of deputy directors who help me and help the agency to fulfill its mission to help seniors in Bucks County. These are some remarkable people who are coffee drinking, chocolate loving, hard workers, but they help. I say we're all sort of in the same boat. These are the folks that really help us some of the oars moving forward and keeping our boat moving. So Karen Tinney is our Deputy of Long-Term Care. She will be speaking to you. I have Bill McTighe. He's our Deputy of Public Affairs. And then Carol Boyle, who is our Deputy in charge of Finance and Administration. And so they oversee the three main areas of our services that we provide services to seniors in Bucks County. So thanks, guys, for everything. May is Older Americans Month, and this month, this year, the theme is Age My Way. We have over 160,000 seniors age 60 and up in our county. That's about 26% of the population. And 160,000 people are going to do things their own way. And what we want to do is try to enhance as much as we can and provide as much opportunity for people to have the possibility of, as they're getting older, to age the way that they want to. I am myself 60 years old, And so being 60 years old, I fall into that category. And I am very different than another 64 years old. We're all different. We all have some similarities and needs, and so we try to meet some of those needs. But May, we are celebrating the diversity of what is out there for our seniors, and to think beyond sort of some ageist theories and stereotypes that we have of seniors. This is an opportunity for all of us to explore the many ways older adults can remain in and be involved with their communities. And that's been really, really hard during the pandemic, and we've tried to do some things to help assist people staying involved, and we'll get to some of that, but we want to continue that for seniors in our county. I would like to welcome Rachel Neff to come up. She is our Director of Human Services. She's my boss, so everybody applaud. Yay! And she's going to talk a little bit about some of our human services, other projects that we are doing, and how they intersect a little bit with our services. So Rachel, thank you so much.
All right. Thanks, Kathy. And it's good to see everyone this morning. And I really want to say it's a good way to start your week with Kathy Bennett and the Area Agency on Aging. And I agree with you 100%, Kathy. There's a fantastic team here in Bucks County. And Karen Tinney and Carol and Bill are fantastic people to be leading our Area Agency on Aging with Kathy. So thank you for all that you do. So as Kathy mentioned, I'm Rachel Neff. I'm the Human Services Director for the county, and 3 items I just wanted to briefly highlight this morning because they do intersect with the work that's happening in Area on Aging. The first is that in February of 2021, I have to get my years straight here, we launched our Bucks County Human Services Hub, which was, I think, a really welcomed addition to our continuum of services in Bucks County. And one of the things that we learned in the first year of the hub being open is that there were over 2,100 contacts, which in and of itself demonstrates the need for having kind of a information referral, an opportunity for people in the county to reach out and say, I'm looking for some type of human service support. Maybe I'm not exactly sure how to get connected to that. Maybe I don't know the first starting point for it, but the hub is really intended for people to reach out when there's some type of a need and then to get connected on to that specialized area that can further support them. And we did learn in that first year of the hub being open, so with those 2,100 calls, older adults was almost 10% of the reason for inquiries to our hub. And so that's about 200 calls reaching out for support. And then the approach is that when individuals reach out to the hub, then our resource navigator can connect them on to the appropriate individual within our area on aging for those supports. So again, I think that was, it's a new initiative for Bucks County. I'm glad that we have it. You can see the ways to reach our hub. You can walk in today between the hours of 9 and 4 to access the hub. You can email or you can call this number, which is up on the screen. Thanks, Kathy. So another program that overlaps with Area on Aging is our co-responder initiative, which launched in December of 2020. And I'm really, I'm just so fortunate to work with a team of individuals who brought that initiative to life here in Bucks County. Kathy was one of those leaders in the county when we first got together to talk about the co-responder program. And we started off in Bensalem Police Department, and this model, it's fairly simple. It matches a social worker with a police officer in responding to calls that warrant more of a human service type of response. And so we launched in Bensalem in 2020. From the first year of that pilot, we had 212 calls or individuals that were supported. We then moved, because of some of the early successes we saw with that program, we moved and expanded into Falls and Middletown Township. And that program has really only been up and running since December of 2021. So in the first 5 months of that program up and running, as of last Friday when I looked at the report, 117 individuals up and running in that program. And then very recently in April, this year, 2022, we expanded this initiative to 3 additional municipalities: Bristol Township, Bristol Borough, and Tullytown. And so we have another team of co-responders there. So we have 6 throughout Bucks County. And again, while I won't go into all the detail, we have learned, and the team was on calls even a couple weeks ago with the Area on Aging, because we have individuals who are reaching out via 911 to police for support and help, and those individuals could best be supported by a social worker. So really appreciative of the collaboration, the overlap with Area on Aging, because I know our co-responder team is on calls with Karen Tinney and her team, and Kathy, around how can we support this individual, where is there a gap, how can we ensure that they're getting what they need. So our co-responder model, I just wanted to highlight that. And then lastly, this was, and Kathy, you were right with your remarks, nothing's been going on. Nothing's been going on in Bucks County. This is not an initiative for Bucks County, but a transition that's occurred recently is our Veterans Affairs Department has recently moved over and falls within the umbrella of Human Services. And I'm really fortunate. Timothy Wynn joined us in March of 2022. And he is leading the efforts in supporting Veterans Affairs issues throughout the county. And I believe that there's approximately 48,000 veterans in the county. And I know that the discussions and the overlap have already started. I know Tim and Bill McTighe have been on the phone talking about some ways that veterans and Area on Aging can work together. And again, I'm really fortunate to be working with Tim, and I think that there's a lot that we can do to further support our veterans. And again, there is overlap with individuals that are supported through aging as well. So those are just some of the highlights I wanted to share this morning. And again, Kathy, I'm really looking forward to your presentation, your team's presentation, so thank you.
Thank you, Rachel. And I think that really demonstrates that what we've been doing within the Human Services is breaking down some of those silos that we have, not only within our own department so that we can all talk to one another a little bit better, but also some of those silos with other entities out in the county. So just whatever we can do to make things better for someone that needs help in the county. So thank you, Rachel, for taking the time to explain those. We really do appreciate it. My husband was a police officer, and he used to tell me that he said, you know, I'm really like 80% social worker and 20% law enforcement. And so matching up a social worker with a police officer is a great, great thing. So they can be more than 80% social worker. So I think it's a great program. So here we are just to talk about our agenda. We want to give you an update on what's been happening at the AAA. Whoops. Oh, we're good. We're back again. Okay. See, I told you this was going to be fun today. Let you know about the ongoing COVID-19 response, upcoming challenges and activities that we have planned. We're going to talk about the budget. It's so exciting. I know. We have a dynamic speaker in Carol Boyle to talk about the budget. And then we want an opportunity, as I said, for some questions and comments from all of you. This is the mission of the Bucks County Area Agency on Aging, and I know most of you have that memorized, but I'll just go through it anyway. It's to develop, coordinate, and promote a continuum of quality services that supports, respects, and advocates for older adults and their families, empowers them to maintain independence and dignity, and enhances their overall well-being. We are one of 52 area agencies on aging in the state. We were designated in 1973 by the county commissioners to be the Bucks County Area Agency on Aging. That means next year it'll be 50 years, and so our next public hearing, I think we just might have to have a party, just saying. Our assistance really for seniors is in 3 different ways. It provides education and support to healthy residents. It provides assistance with home and community-based services for those who may need those extra helps in order to stay in their home and be functioning well, and to advocate for rights and benefits of older adults, protecting those at risk for abuse, neglect, financial exploitation, and abandonment. And we do that in a variety of different ways, which we will go over a little bit as we continue our presentation. So we accomplished a few things. in this past year that we wanted to highlight for you. And as I said, there's a booklet that goes over those things so that you can see some of those. The handout that we had can go over some of the information, and there's lots of information in there. We successfully provided services and provided programs and monitored needs remotely, hybrid, and in person. So a lot of that jockeying back and forth that all of us have been experiencing. But I have to give a lot of credit, again, to my team and also to our 60 staff members who have done a phenomenal job of, I think the key word this last couple of years has been pivoting left, right, and center to meet the needs of individuals seniors in our county. We implemented the county telework policy. Some of you may know that in the fall, the county adopted a telework policy so that staff members, and this was just not COVID related, but that our staff could work in a remote area 3 days a week and be in the office 2 days a week. And that's such a great opportunity for our staff to be able to take advantage of both the things that you can do when you're not in the office and get things done and working remotely, but at the same time when you're in the office and connecting with individuals. And it's a really great mix and allows that for our staff. And all of our staff are eligible to be part of our telework policy. But that was a change. And so we did accomplish that, and it's working really well in our office. We continued and expanded the Senior Connect program. The Senior Connect program started about 1.5 years, 2 years ago with some funding that we received through the CARES Act. And this was a way to connect seniors to technology. As I mentioned before, we had real concerns about seniors and them feeling very isolated during the pandemic and not being able to connect with other individuals. And a lot of that was happening virtually, and yet they didn't either have the equipment or the ability to do that. So our Senior Connect program started with 2 of our senior centers, one in Bensalem and one in Bristol Township. And it does 3 things. We have a contract with Comcast so that we can get people connected to the internet that did not have that connection before. It involves purchasing the technology, the laptops or the tablets that will allow those individuals to use that equipment so that they have it available to them. And then once you have that, do you know how to use it? So then the third part of it was providing training and support to individuals so that they could learn how to use that technology. We have expanded that program this year to to Northampton Senior Center, and we're currently working on the potential of a third-party nonprofit to assist us in some of the areas where we are currently not providing that service. But we feel it's a really important program, and the results of some of our outcome measures have just been extremely successful for individuals who had no other way of connecting with individuals. And as many of you know, in order to get any services sometimes, such as if you want to apply for LIHEAP or Social Security or any of those kinds of things, you have to do it online. And so if you don't have that ability, then you're stuck with being able to do that. So this helps in that manner as well. We assisted homebound seniors with vaccines, getting their vaccines. We didn't provide them. We had somebody go in and help with that. Distributed care packages and distributed COVID test kits, and we'll talk about that in a little bit as well. We participated in, and I'm one of these people that has a real pet peeve about using acronyms without spelling it out first, but I did it here myself. PDA is the Pennsylvania Department on Aging, and they are the state office that we receive funding through, who monitors our services, et cetera. So we participated in their PDA's Intergenerational University Connections program with students from Westchester and actually in Lackawanna, Scranton, the St. Mary's. We also have students there who are connected to seniors, and this is a learning opportunity for them, but they connect through phone calls to them on a weekly basis, become their buddies, get to talk to them, learn from them, and also find out what their needs are. So we have about 15 or 20 seniors currently that are involved in that program. We started last year, and then we're continuing it for this year. 70% of our staff completed SAGE training, and SAGE stands for something. Anybody know? No. Okay, so it's seniors, but basically SAGE is an organization that provides trainings and cultural awareness for people of LGBT individuals. And so SAGE has this excellent program that they developed and that they allowed all of the area agencies on aging through the Pennsylvania Department on Aging to provide training on cultural awareness, again, working with seniors who are from LGBTQ populations. And so they were hoping that about 50% of AAA staff in each of the AAAs would complete that training. We had 70% of our staff complete that training. We are trying to raise, again, awareness and understanding what the diverse needs are someone that has, that is from one of those populations and how that can impact their ability to get services that they are comfortable with. And then with ARPA funding, that's the American Recovery Act, funding for shared housing program and for in-home technology monitoring program, and we'll talk about that a little bit more as well. So I'd like to introduce, again, Karen Tinney, who is going to talk about our long-term care services.
Hello, everybody. It's interesting. I was talking to a colleague earlier that I've actually testified before the Senate in the state of New York, the House of Representatives. I've testified before Congress. But for some reason, this is actually making me more nervous than those times. And I think it's because I have staff here. And I want to say, I did come to Bucks probably about little over 2 years ago. So if you do the timing, I came 6 weeks before COVID hit. I was working in New York City for the sister agency, area agency over there, doing program development. And I got that job, if you listen, because I was a lobbyist for senior services and seniors in New York. So I've come full circle. I was really fortunate when I came to Bucks to adopt a department that has one of the most dedicated, nimble, passionate, and staff of 42. I have 4 clerical and administrative staff. I have 5 INR case managers. I have 8 workers in our care management program. I have one of my care managers does caregivers and options care management. I have 3 Fed assessors, which is Medicaid eligibility determinations. Did I forget anything? Oh, my supervisors. They are my rock. They make me do amazing things. It takes a village to support the seniors in Bucks County, and I am fortunate to be working with the best. So I'm going to talk a little bit about the accomplishments of our department. So I am a representative of all of the people I just mentioned, and anybody who I didn't mention because I didn't write it down. I'm doing it by memory. So I kind of call it the annual shuffle. When I came here 2 years ago, I saw a couple of changes that I wanted to make into the department. So I've done a couple of reorganizations, and the most recent reorganization was you'll hear a little bit later, but protective services. We've had an increases in investigations and reports of need on a yearly basis. So we increased the care management staff, and I also made 3 protective services supervisors, which has helped. And we also took 2 contracted positions, thanks to Carol, to shift some money around and make full-time care management positions. So that's helped our department kind of come together and gel and really kind of weather the storm of COVID. We've had to be nimble, flexible, emotions high, compassion fatigue all over the place, but we've gotten through it, and I think we're in a really good place. A couple of things that we've done. In our options care management program, we've adopted a model called consumer reimbursement, where we reimburse the consumer for services that they purchase. And one of the reasons why we did this, it's a state model, was, as you'll see a little bit later, I don't have to click it every single time, that's good. A little bit later, I'm going to talk about, One of the biggest challenges that we're facing is there is a direct care worker shortage. Not enough home care aides, not enough home support aides, not enough personal care aides. Part of it's due to mileage, part of it's due to the pandemic creating jobs in other areas that the wages have increased, but direct care worker wages have not really kept up. So we're seeing significant problems in the direct care workforce. And one of the things that we did was consumer reimbursement. If you can find your own aide, we will reimburse you for that. So we also did bi-weekly calls during probably about course of the 2 years of the pandemic to our high-risk seniors, people who were high-risk social isolation, high risk because of their medical needs. So my care managers were on top of that, and they did a really great job keeping those seniors connected to us. We also implemented a counseling program under PDA, Kathy mentioned before, a PDA waiver, to provide counseling over the phone, telephonically, and in person in the person's home to people who are uninsured and underinsured. And that helped people also feel connected. A lot of seniors, 1 in 5 seniors, experiences anxiety and depression, and we were able to provide that to them. So I talked about that, the direct care worker force shortage. Next, I want to talk a little bit about our services directly. Protective services, this year we're projected to see just investigate 1,600 cases of elder abuse, neglect, exploitation, and abandonment. And that's 12 care managers doing 1,600 investigations. And the number of reports of need that we got, that our INR department and our on-call staff, is 2,200 reports of need. That's up 12% from the last year. So that's one of our, unfortunately, I'm not really sure how we're gonna stop this bleed and get people to be less, abused. It takes a toll. So I hope to see that number decrease, the investigations, because it just means that there's a lot more need out there. And Rachel mentioned earlier the co-responder program. That has been such a godsend to us to have this connection to law enforcement and protective services. We've been able to do a lot of case conferences over the past, about 5 months now. So we've developed relationships there. And the biggest thing that we see, oddly enough, the biggest report of need that we see in protective services is self-neglect. People who haven't really kept up with maintenance of their emotional health, their physical environment, and that we see them at probably their worst days of their life. So my care managers and investigators go out and try to ameliorate those problems. Talking about in my information and referral department, we'll see close to 5,000 people calling us or emailing us for mostly housing, eviction, homeless services, but also home support, home delivered meals. One of my staff members who's on right now is going to laugh because we got somebody who called and says, my building is going to have the elevator out. What do I do? I'm disabled. So they're researching that. So they get calls left and right from any kind of topic, and they take them. They are also responsible for taking those reports of need in protective services. So it is a very, very, very busy department. Our caregiver support program. This past year, we added 4 different educational events for caregivers, and we advertised it throughout the state. So by the end, we probably had about 45 people on a webinar with a nationally recognized speaker, Dr. Barry Jacobs. And we also did one of the educational programs that we did. We had a program that was really well received. We actually taught people how to take care of somebody physically, how to dress them, the tools necessary to feed somebody, a loved one, and different gadgets that you can get in your house to make it easier for somebody to live in their house. Not on here, but I just want to mention our federal Medicaid eligibility assessment department. We saw, hold on, I have the number here somewhere. we investigated, we did over 3,000 assessments in that department with 3 care managers doing those assessments, and we did 2,000 redeterminations. So they were quite busy. And our options care management department are rock. They go out and support seniors in multitudes of ways. It's not just getting them personal care or home-delivered meals, but it's advocating for them if they have a problem with their landlord. It is calling different pharmacies to see who delivers. It is helping them set them up with grocery shopping services. Our care managers we had 650 new people join our program this past year. So I think what I want you to take away from this is that, with 42 staff members, they are quite busy, and they're quite dedicated to the elders of Bucks County. And we look forward to continuing that in a little bit more stable of an environment with COVID kind of going down. So I think that's it from me. Thank you.
Karen? So we also have Bill McTighe, who's going to come and talk about our Public Affairs Department and some of the things that they have done in the past year. So, Bill.
Thank you, Kathy. Thank you, everybody. I'd like to go through some of the highlights for the Public Affairs Department, but I'd like to also repeat a theme I think that you've heard so far, and that is the dedicated staff that we have here at the agency. What we do through public affairs would be impossible were it not for the cooperation that we get with agency staff and my fellow deputies, and also the volunteers and the senior centers that there are out in the community. So I'd just like to start out by saying it's a learning opportunity and a great opportunity to provide service. So just to highlight what goes on in the nutrition program, first I'd like to describe the nutrition program. And the basic purpose of it is to be able to provide, for each meal that we send out, 1/3 of the daily required intake for adults 70 plus. We have a congregate home-delivered meal program and shelf-stable meals. And we have a distribution network that's comprised of staff and volunteers at senior centers, a nonprofit called Woodside Meals on Wheels, and I'd like to take an opportunity to thank especially the senior centers and the volunteers and Woodside Meals on Wheels for the service that they provide. It's invaluable. To try to pay for that service would be exorbitant. We also have drop ship meals. So the nutrition program is basically comprised of congregate, home-delivered meals, shelf-stable meals, and drop ship meals. And there's also a phase of it that's compliance. That's, first of all, we have to be sure that the menus that go out are approved by a registered dietitian. Otherwise, what we serve is just not, it doesn't meet the objective, so to speak. So that's key. The other thing that's key is that the facilities from which these meals are produced, we have a food vendor who's off-site who brings them in through a public bid process, but also we have senior centers that have persons in charge at the kitchens. They have to be ServSafe certified or a national certification for food and health safety. And also we monitor the facilities with a third party to ensure that they're meeting up with state health and nutritional guidelines. As I said, with the food sourcing, if you take a look at the senior center network, all of the food that's provided through the senior centers is provided through a public bid process, and we have right now a food vendor called BTC Foods. Previously, our previous vendor was unable to, deal with the inflationary pressures that exceeded really what we're able to provide for in our price escalators in our contracts, so we had to put it out for bid. And April 1st of this year, we engaged a new food provider. The price went up from $4.30 a meal to $4.64 a meal, and all things considered, that's really, not too bad given this inflationary environment. The price increase, as I said, we had that price increase. The number of unduplicated consumers that we serve through the nutrition program is estimated about 1,770 people. And of the 154,700 meals that we serve this year, that averages out to about 650 meals per day. Now, the pandemic had quite a severe effect on the program from the start in March 2020. And even as the difficulty of the pandemic kind of eased over time, it really didn't show itself too well in the congregate meals program and the home delivered meals program. We had suspended hot meals all the way up through October that just passed, and had substituted them with frozen meals. That process not only enabled us to be able to provide the meals 7 days a week to people who needed them, but also knocked down the amount of contact that there was between the volunteer who delivers the meals and the consumer. Things are kind of restoring to normal, but people have actually preferred frozen meals for a couple of reasons. One of them being that they don't have to be available 5 days a week to be able to receive the hot meals at the door. And it gives them the opportunity to consume the meal when they want. So in a nutshell, that's the nutrition program as from the funding that we normally get. There's also a produce distribution program that we were able to implement with county money through ARPA funds and CARE funds. And that program last year we implemented through Snipes Farm and Education Center. The commissioners, when they had come in, I guess 2-3 years ago, they had a transition plan, and the transition plan, among other things, was to, one of the goals was to relieve food insecurity and to support public or local businesses as much as possible. So we were able to connect with Snipes Farm with county funding, and we're able to produce 3,600 shares of fresh produce, organic produce, distributed over an 18-week period. That amounted to 21 tons. That effort was supplemented by United Way of Bucks County, who had also provided over 10,000 pounds of food during that period. And we also wanted to acknowledge Rolling Harvest for the transportation that they provided to various centers with the produce, and also to supplement it with fresh produce, milk, and eggs of their own. So that's what's going on in nutrition. We provided guidance to senior centers in developing reopening plans. Senior centers closed from March of 2020 all the way through, well, essentially last year. There was one senior center, Morrisville Senior Center, had ventured into the pandemic kind of boldly and successfully. They opened up in October of 2020, but the next senior centers that followed suit weren't until April, May, June, and finally the last of the senior centers through September of this year. So the pandemic's been quite a difficulty, but at the same time, the senior centers have been quite active. They've maintained the in-home meals program. The senior centers that were closed were able to do public or in the parking lot types of activities. They had a vaccine clinic, they had a car bingo, even just drive-bys to give ice cream cones and sandwiches to people who would come by just to say hello. They also the telephone assurance. But the thing that was probably the most telling during that time was the concern that every senior center had for the health and safety of their consumers. The senior centers themselves have their own character, and the governing boards of each of these senior centers had their own view as to how to approach problems. So as the CDC guidelines would change, and as the senior centers would consider how soon are they going to open, there would always be a back and forth as to what if this, what if that. And there was quite a bit of dialogue that went on over that time. Senior centers also have helped us provide test kits to the public, and also the care packages that Kathy had talked about. The care packages were things that enabled people to get back out into society with a little less concern. Masks, hand sanitizer, things of that sort. The next thing we're going to talk about the Senior Center Farmers Market Produce Vouchers. Every year, from June through September 30th, the Pennsylvania Department of Agriculture provides us with produce vouchers to distribute to people who qualify, and there's an economic threshold for that, to be able to use those produce vouchers at farmers markets throughout the county. Now, the farmers markets have to be signed up with the PA Department of Agriculture, but people who qualify get $24 worth of vouchers, and a couple can get $48. It's really been a great benefit, and as early as February or March of this year, we've been getting phone calls when you're going to give the produce vouchers out, and they are coming, but the department had their own Department of Aging and Department of Agriculture had their own issues with supply chain and being able to get those printed, but they'll be out very soon. Last year, because we had like a hybrid model as to whether we were going to give the produce vouchers out in person or otherwise, we were able to have senior centers were able to help us, and we also had an application process. So we processed these produce vouchers through the mail and all through the senior centers, and gave out vouchers to over 2,000 people. So that's been a successful program. I'm gonna have to excuse myself and get a little bit of water, excuse me. I'd like to highlight what goes on in the volunteer program. Much of what we are able to accomplish through public affairs happens through the senior centers. The senior centers have quite a group of volunteers who are dedicated, but there are also other programs that we provide through the volunteer program. Senior games, health and wellness activities, PA Medi, which is the Medicare Insurance Counseling Program, and the Ombudsman Program. Were it not for the volunteer program that we have, we just wouldn't be able to get the people on the street. We have over 176 people who gave services last year, totaling over 13,000 hours, estimated about a value of about $375,000. As a volunteer program, it's also key that we get in partnerships throughout the county so we can better serve and get our services out into the county. We've developed partnerships with Children and Youth, NOVA, Habitat for Humanity, the Churchville Nature Center, Bucks County Intermediate Unit, and Neighborhood First. And as we continue with the program, we'll continue to try to match people's needs and their interests with the needs in the community. We've also partnered with Montgomery County AAA on certain projects. I think I'll leave it at that. There's some details that aren't as key here. Then there's the PA Medi, the Medicare Insurance Program. It used to be called a prize. A prize didn't really stand for anything. It was just, you would think it's an acronym, but it's not. That changed to PA Medi. They changed the name July 1st of last year. It became official January 1st of this year. And as the annual open enrollment for Medicare came about, we thought it would be a great opportunity to roll the new name out for PA Medi. So among other things, besides changing our literature for the prize program to PA Medi, We also had a television ad campaign on Comcast and Verizon, and that was a very successful program because this past annual open enrollment period, we counseled over 1,300 people. Year round, we had counseled over 1,600 people with just 15 counselors who, again, volunteered and just one staff person. So they've accomplished quite a bit. As you know, the PA Medi program is meant to help people save money on Medicare expenses and help them choose the best health insurance that they can get. Also, the other thing with PA Medi is it's important for people to really understand, obviously, the basics of Medicare, and so few people do. The counselors have put together a 1-hour video that's posted on the agency's website that takes you through the ABCs of Medicare. And we give them a lot of credit for their efforts to do that. Next, the Ombudsman Program. The Ombudsman Program the purpose of that is to advocate for quality care for residents of long-term care facilities and people really who receive long-term care services generally. Again, without a volunteer force of 6 people, in addition to our staff, we wouldn't have been able to accomplish what we did. But the number of reports of need or incidents and assessments that we've had was over 1,000 for the year that just passed. And I'd also like to mention, too, that with the pandemic, we were unable to do the facility coverage visits as we were required, well, because the facilities were closed. And what made it interesting with the pandemic is that nursing facilities are regulated by one regulatory agency, assisted care facilities and personal care facilities by another. And every time the CDC guidelines would change and we would try to go out to do these facility assessments, there would always be, a whole bunch of talking, well, what do we do next? And with the guidelines as to people, the people in the facility having COVID, who has COVID, who doesn't, we wound up doing much of our work over the phone. But things are returning to normal now, and we'll be able to get back out. We have over 100 long-term care facilities in the county, and they have to be looked at least once every quarter, facility coverage visits, and they're up to the task, and they'll continue to work through that as the pandemic hopefully subsides. And then finally, the health and wellness programs. The whole purpose of that is to promote health and wellness, as you'd expect. And there are evidence-based programs. There's a chronic disease self-management program, the falls prevention program, Healthy Steps, and there are other programs that we're looking to roll out. But again, like with everything else, volunteers are the key to us being able to do that. These programs require certifications. Volunteers go through certified classes and mentoring and help us get that done. And then also there's non-evidence-based programs. We have a chair yoga that we've implemented as a virtual program, and that's been really quite successful ever since the pandemic happened to us. Senior Games is another key part of what we do in health and wellness. Last year, because of the pandemic's restrictions and people's concerns, we had all of our activities outdoors and we had virtual events. We had over 280 people who had attended. They were very, very happy to get out after being locked in the house for about a year and a half, and turned out to be very successful. We're going to continue with the games this year, and we're going to do outdoor events, live events, and virtual events, and we're hoping for a real good season. There'll be 28 events of different types, and about 15 venues that we've engaged this year. Also, one and final last note about the health and wellness program is there's also a prevention dimension to health and wellness. We work with Bucks County Drug and Alcohol. We receive funding to engage certain prevention practices, and we've really been focusing mostly on medication safety. Excuse me again. One of the things that's really key in terms of, excuse me, in terms of medication safety is what do you know? What do you do? How do you meet people's educational needs? Last year, we had engaged the Melior Group, which is a marketing consultancy out of Philadelphia, PA, to do a research project. And the whole purpose of the research project was to say, well, what's going on in the community? What types of substances are people taking, whether they're prescription drugs, over-the-counter drugs, alcohol, marijuana, opioids, things of that sort. So we wanted to gauge the use of medications and the perceptions of substance abuse and whether or not people are perceiving what their behavior is, whether that's abuse, use, or whatever. So understanding the behavior of Bucks County seniors regarding the use and abuse of substances, prescription, over-the-counter, and alcohol would provide support to the initiatives to improve the health and welfare of the seniors. We had over 1,100 respondents to this, and I'd just like to take you through a couple of the findings. When we went into the study, we figured because of the opioid epidemic, we would find that there was a lot of abuse that's going on with opioids. Turns out that that wasn't the case. The biggest issue was the anti-anxiety drugs are used significantly more than opioids and sleep aids. Although the oldest age cohort takes more prescriptions overall, those under age 70 are significantly more likely to be taking a potentially addictive drug. Another finding is in examining those who take potentially addictive drugs, 2 in 10 have intentionally taken less dosage than the prescribed. Bucks County seniors use over-the-counter products on a regular basis. More than 3/4, 78%, take vitamins. More than 54% take pain medications, and 2 in 10 take over-the-counter sleep aids. With this information, we're going to be able to develop newer studies to better focus our efforts on prevention, and again, just try to bring medication safety to people's attention so that they can better use what they do use. I think I'll stop with that.
So let me do a check-in. How you all doing? People that are on virtual, you thumbs up, you all right? You hanging in there? Excellent, great. You know, if you were here in person, there's coffee outside. Just saying if you need a quick. So we'll quickly go through the rest of this information for you so that we can spend some time on the budget. Just some ongoing COVID kinds of stuff because we've had people ask us, what do you do during COVID? How do you change some things? What's been a lot of fun is that we're in, we're out. We're in, meaning that we could go into people's homes, but then we couldn't go into people's homes, but then we could go into people's homes. We're in the office, we're not. So again, all those kinds of things that we had to pivot and deal with. We're kind of unsure about the future of some congregate meal kinds of things. One of the things that has come out of this, as Bill was talking about with nutrition, is that the senior centers were developing what they called grab and go. So you didn't have that interaction that you had during congregate meals. You just grabbed something and you would go and take it with you, but at least you got your food. Some people really just like that. And so that whole but that's not really what is in the Older Americans Act about how services are to be provided. So we're not sure if that's going to continue or not. And also, it's interesting from a senior center perspective in that the congregate meals is really to help engage people socially. So if you're grabbing a meal and you're going, where's that interaction? So it's kind of an interesting thing and that we need to think about as we're going forward. We want to increase the Senior Connect program. We want to help homebound seniors to get their vaccines that they need. We have done some of that. We worked with the Bucks County Health Department and with the Bucks County Health Improvement Partnership called BCAAA, and they were really, really helpful in doing that. As Bill talked about, we had care kits that we sent out, and we did distribute either through mailing out to seniors that are our clients, or through the senior centers, over 7,000 COVID test kits just to seniors. So some challenges ahead. We have had flat funding for the past 8 years from the state government and from the federal government. Flat funding means that we haven't gotten anything extra. It also means that the requests on the part of seniors has gone down. It has not. It continues to grow. You could look at that and say, well, the costs haven't gone up. Well, yes, they have. So we're keep having to be at a point where we're not getting any additional money, but we're getting more people asking for services, and the costs for those services continue to go up. And so that's really a big challenge for us as we move forward. And there's been a lot of advocacy done with legislators, but any legislators that happen to be on at this meeting, I would love to have a conversation with you about that at some point. At some point, the Recovery Act monies will go away. And so some things are funding services we're providing now or help to offset costs aren't going to be there. So how do we plan for that in the future? Distribution of the ARPA funds and reporting guidelines, there is a lot that goes in with some of these projects and receiving these monies, with the contracting. There's a lot of administration to these funds and to ensure that they're being used properly. Again, that was not like anyone in our departments that handle budget and contract and those kinds of issues were just sitting around twiddling their thumbs. No, they've had to add that on to what they're currently doing. And so that's been a real challenge and will continue to be a challenge for the next couple of years. The assessment program, just so you know, I could talk for an hour on that, and I know you want me to, but no, I will not, is that the State Department of Human Services that actually is funding our assessment, or what Karen calls FED, or Functional Eligibility Determination for medical assistance individuals. The Department of Human Services has put out a bid to see if they could take two parts of that program, assessment and enrollment, and roll it into one. And unfortunately, who they selected to do that, we have a lot of concerns, because they're the entity called Maximus who are currently doing the enrollment, and there's so many problems and difficulties with how they're providing that service. So possibly assessment, we have three ways we can go about this. Department of Human Services will take assessment away from us. And so that would be about $700,000 of funding that would go away. They could decide after all this for us just to continue as we've been doing and keep Maximus just doing the enrollment piece of it. And so we just status quo. We'll just keep going as we had been. The third possibility is that they may say, okay, we hear what you're saying. Maximus isn't doing a great job. We're going to keep them, but we'd like you to do a little bit more. And hopefully along with that will be increased funding. So the assessment program is one of those, we're not quite sure what's happening. We should know, I keep saying this, you guys that have heard me talk about this for about 2 years now, but we should be hearing by July, because our assessment contract is due for renewal by then. We have a lot of reporting requirements from the Pennsylvania Department on Aging. They have to monitor our services. They are accountable for how we do things. But there's also sometimes the fact that what they're requesting from us is somewhat difficult in reality when you're going out to see people, to add that additional requirements to what we're already doing. And generally those requirements have a lot to do with such things as case notes and documentation and those types of things that just keep getting more complicated and multi-layered and make it difficult for our staff. And so with those increased reporting requirements, then it also becomes, how do we juggle that with the staff that we currently have? Because remember, flat funding for the last 8 years. We are seeing such a decreased need, or complex needs of seniors. As Karen was talking about, one of the number one things that people call us in our intake and referral department is around housing. There are so many mental health needs that, as you have been hearing about during COVID, have been hitting all different kinds of populations. That's also true for seniors that are out there. We have a number of different projects we haven't talked about regarding mental health and trying to assist individuals, but they're coming to us with systems that the demand is greater than what the supply is. So we're having to deal with that. There's difficulties with finances. We're in inflation. Rents are going up. Taxes are going up. There's all kinds of things that are making it difficult for seniors to stay financially solvent. And then guardianship happens when someone is in a position where they are no longer able or competent to take care of their financial or physical concerns. And we're seeing an increase of those guardianship cases, and we're probably going to see additionally more of those, which is good in that we're getting to know about those. But on the other hand, it is also something that takes a lot of time, court time, et cetera. Karen talked about a lack of direct care workers for in-home services. We're also dealing with caregivers who are in a sandwich generation. I was just talking to a woman who is 70 years old, is taking care of her 94-year-old mother, and is dealing with a 17-year-old grandson who is having some drug and alcohol issues. We are dealing with a lot of multiple issues that are impacting our generation as we age that was not something that was dealt with before. So there's a lot more pressure on caregivers as they're helping raise grandchildren, as they're multiple aging generations that are needing support. And then we have, I don't know if you know this, elections coming up. There will be a new governor, there will be new senators, so we will have new political leaders. There has been a what's that called, where you change who your leaders are, the redistricting has happened. And so there may be some changes there that we need to meet with other legislators. But all of this is something that will take our time and energy in order to assist. And we don't know what their agendas might be and how they might change some things. The number of seniors continue to rise. I show this figure every year because I just want you to see that it keeps going up and that we will continue to have more seniors with more complex needs. And did I mention that we've had flat funding for the last 8 years? Yeah, okay, so just wanted to bring that up. So now Carol will be talking about the budget, and thank you, Carol, for doing that.
Good morning, everyone. I have the shortest amount of slides, which means I'm going to take 2 minutes to go over the entire budget and all the changes that are coming. So just a reminder, for those of you that have been here before or not, the agency works on currently 2, sometimes 3 different fiscal years simultaneously. I joke with my fiscal team that we are constantly building a budget for somebody. The county works on a calendar fiscal year. So when the county numbers come out in August, September, October, November, December for the upcoming year, and it shows how much money aging is going to be receiving, that's how much money is being allocated to aging for the period of January through December. For those of you that are remote, if you see something red flying around on the right side, it's called the cast. Just, don't pay attention to it. I'm trying to cover it. The other part that happens with our funding is we work on a state fiscal year simultaneously. So that state fiscal year is July through June. And the interesting thing about the state fiscal year is when we receive money from the state, come June 30th, if we haven't expended it, it all goes back. And the problem with that is that when the money goes back, we're still in a county fiscal year. And so we don't always get the money back. So we are always really looking at when is the money coming. And I'm prefacing it this way because this is what happened this year with our CARES dollars. From the state, in the Department of Aging, we received CARES dollars. They told us we were going to get them back in September. May, just the other week, we finally got all that money back. We have till June 30th. So it is always a game of back and forth and whose budget are we working in. So I bring that up because when you look at expenses for fiscal year 22-23 that you see in that cute little pie chart, and we made it all colorful, what we're looking at is specifically for the period of July through June. When we present for the county will have a January through December of all of 23. What you're seeing here in the breakdown and in the detail in the book, the short response is that we are anticipating an overall increase in our expenditures by 4% in comparison to our 21-22 anticipated expenditures. So we compare the two. So when you look at the public hearing book itself, I would say to go to page specifically 17, where we're doing this comparison of growth to growth, area to area. When we go through the details of what we are looking at with our expenditures, the greatest areas where we're going to see some expenditure that we were not anticipating or could not have anticipated, one of them is in administration. When we're looking at administration, we generally run in our overall budget between 12 and 15%. What makes up that administration, and one of the things that we were not anticipating when you look at the amount that we are anticipating an increase, has to do with the move into the building here. I say that specifically because for a year and a half, we didn't have any rent or utilities. But now we are in this building, and so there are additional expenses that are coming with that we could not have anticipated because we weren't all here yet. The other piece that comes with that is we are anticipating, and I did not even begin to attempt to project, how much that move cost us. Is it a good thing? Yes, it is very good to be in the building. I like not having to climb up into a ceiling. I like not having to put on my rubber boots and sometimes have to get out the wet dry vac because we used to have some flooding in the other building we were in for many years. I like not having to shovel. I like wearing big girl shoes. Okay, first time in 2 years I got the big girl shoes on. But with that comes also the expense that we have not had to incur for the last few years. So we knew that was going to happen. The other areas where we are seeing some significant growth, or it looks like a significant growth or a decrease, has to do with our home-delivered, congregate, and senior center. In the budget, when you look at the detail of where we think we are going to end this year against where we will be next year for social rec activities, we're seeing a significant decrease of 40%. That sounds like a lot, but let me be clear. That is specific to CARES dollars that were provided to do additional things above and beyond what we normally contract. Those dollars are gone June 30th, and so those above and beyond activities that we were doing or supplementing or providing additional funding to the centers during the COVID time period and the CARES dollars availability are going to go away. So it looks like we're decreasing them, but we are not decreasing our overall budget for them that we have been working under. Included in there is a shift where we are looking at our nutrition a little bit differently. So during COVID, we had a lot of home delivered and very small percent of congregate. Now that the centers are reopening, we're starting to shift those numbers. Those numbers being shifted shifts some of the expense. In the home delivered area, we are anticipating an increase, an 8% increase in our overall operating costs. Some of that has to do with we went out to bid. Oops. I always thought I was loud. I apologize. Luke, I am your father. I couldn't help myself. I had to do it. I had to do it. With the nutrition program, and when we look at home delivered, we have a new vendor. When you put it out to bid, that's going to increase that rate. And it's not at our set. It's at the costs that come in with that bid. That was not anticipated at that volume, but we are going to absorb that. The other piece that is happening is many years ago, not many, I want to say 5, I think, with our drop ship meals. We didn't realize when we started with our drop ship meals the need that was in the areas of the county that are not being served or unable to be served because of distance and needing to maintain temperatures around our senior centers for home-delivered meals. When we started that program about 5 or 6 years ago now, 7 already, we budgeted $25,000 5 years ago. We're anticipating that amount to be around $175,000 going into the next year. That is where there are larger pockets that we did not know until we really reached out there. And again, with the nutrition program, we are going to continue with that to meet the growing needs of the individuals who are in need of supplemental services or their primary or secondary meal during the day. Other areas that we're anticipating for growth with our expenditures, one of them that we weren't sure what was going to happen when things started to reopen is under our in-home services and care management area. So when you look at the pie chart, 26% of our overall operating. What that makes up in there is not only our care management services to individuals and going out and helping to coordinate and provide information and manage overall coordination of that care, but also the care itself. So our personal care services, our home support services, our adult day services, personal emergency response. For those of you that remember, and this is where I realize how old I am, help I've fallen and I can't get up. We're referring to those types of units that we provide in the community to individuals that need them. And then there's also medical equipment and supplies. So for some people, the idea of dignity is being able to have the appropriate incontinent wear. And incontinent wear is very expensive. So even when you may be eligible for medical assistance, the quality of the product may not meet the need for the product that you really need. And so those types of things also fall under our care management and in-home services. What we have seen in the rebounding with direct services, direct workers, that shortage occurring is an increase in our adult day service utilization. It is a wonderful service for multiple reasons. For individuals, it provides them going out of the home, being in a community setting, being supervised for the caregiver if that individual needs some assistance, nutrition. They do have meals while they're there, various activities, and it's not just for individuals who are cognitively impaired. It's also for individuals that may have some type of physical challenge, but what they need is some support. That service during the height of the pandemic significantly dropped because they were also closed, affected like the senior centers were. What we have seen in the last 6 to 9 months is we thought we might be some rebounding a little bit. We thought we'd be at maybe 60,000 originally this year. We're anticipating we're going to come in at about 150, I believe, and that we will probably be at about 175,000 for next year. So what we are also seeing is some shifting in our funding of where we're going to use it. So an individual may have been receiving personal care, but maybe because of a direct service worker shortage, the individual is now going to adult day services to receive some of those services and supports that they would have otherwise received. So we are doing some shifting in that area also. The one area that is going to go down, and it's going to go to zero for the 22-23 year, is going to be our counseling services. And when I say that, that's specific to individual counseling at this time. The Department of Aging provided our agency what they call a waiver, an allowance to do a service that we do not normally provide through the Department of Aging funding. And so we have been using our CARES dollars to help people through that isolation period. As we are transitioning to the new normal, we are able to reconnect people with other community counseling supports and services, but we were using it during the time period where people were not getting out as much. So that service will be going away. It wasn't extremely high in its utilization, but we were thankful that the Department of Aging had given us an allowance to provide that service with their funding for those that really needed it. That sense of isolation has its own impact and rippling. Those are the highlights of where we're anticipating with our expenses. So we're going to have some growth, we're going to have some decreases. Yes, I step away, I walk around a lot. Can I lift this mic and just kind of walk? Beautiful, because I cannot stand still. So in that respect, we are anticipating, as I said, overall a 4% increase. Our staffing, we will most likely be holding pending what happens with the assessment activity. So we aren't anticipating necessarily adding large volumes of staff. One of our biggest challenge with staffing has to do with the requirements that the state keeps sending us. So when they increase those expectations, there's only so many hours in a day. So as of right now, we are not anticipating it. Changes in assessment may result in that. Now to the revenues. I want to point out on the revenue pie, there's this big, huge blue, and that's the Department of Aging. They have primarily and usually been our primary funder where we receive our funding. It is a standard grant. It is broken down into more lines than I care to discuss when it comes to the revenue, because each line of every piece that is in that revenue is restricted in some way, shape, or form in how you can use it, where you can use it, how much of it can be used, and how much of it can't be used in certain areas. So behind the scenes, we spread it all around, move it all around, and make it work with that. But there's one little slice of the pie up there that's pale blue and doesn't have any headers to it. That little pale blue is a deficit. It's approximately $203,000 that we're not going to be able to match yet. There are things in a state of flux that require us to not quite be sure what is going to happen with the state revenues, how much additional funding they may send down. So I want to say, for example, we get a preliminary budget with our revenues from the Department of Aging somewhere between July and September. And in December, January, or February, we get a revised budget with an amount, depending on where they are. And then again in May. And this year, we just had a random notation that came from them of some additional funding with extreme restrictions. And we got that last week, so that wasn't even in here. So there are some parts of this that we are just not sure, and so we leave that as its own little wedge that we are going to be watching for. Other things that we are looking at is the Department of Human Services. That's specifically the State Department of Human Services. That has to do with our aging, part of our aging well. We have the county, which we try to keep between 13 and 15%. We are asking the county this year, when we put in for our county budget, to take us back to our 2017 adopted budget. So what I mean by that is, this year, we are approximately $1.2 million, and we are extremely thankful to the commissioners and the county for supporting us. The interesting part is that in 2017, we were at 1.6. Now, during that time period, we have advocated and utilized and maximized lots of other funding. And in the middle of the pandemic, we received the CARES funding that we were able to use instead, and we've received some adjusted funding from the state. But those things are starting to go away. So as those pieces dry up, we will be going back to the county to ask again to return us to our 2017 adopted budget that they had provided to us at that time. Other areas that we are looking to do is to also look at expanding. So there are some programs we want to continue and support through next year that we would not have otherwise been able to support, so we may be going to the Department of Aging, and it will fall outside of the Department of Aging grant, to a special discretionary grant for certain special initiatives that we want to see continue. One of them would be our fresh produce boxes that Bill had mentioned, working with the local farmers to be able to provide fresh produce. It is so important with our nutrition program. Yes, we have grocery stores, but a lot of that is coming from somewhere else, so it keeps it in the county. And it's seasonal, and we want to be able to continue that. So I guess I covered the pie all at the same time while I was showing my other pies. My favorite is strawberry, by the way, if anybody is wondering, and it's that time of year. From our expenses, there are some things overall that we can control, and there are things that we can't. The things we can control are things where we've made improvements. So, for example, 5 years ago, paper, pens, notebooks, things like that, we were at $10,000, $11,000, $12,000 a year for our agency. I think we're at $4,000 because we've gone electronic. There were certain positives that came out of this whole process where staff are really maximizing what do I need and what don't I need, because I'm doing it all electronically most of the time. The things that we can't control, there are changes to the reimbursement rate for mileage that come out federally. I am almost afraid to see what the next one's going to look like, given what we're looking at for gas right now. And there are cost of living increases that happen. Those things we can't control. It's going to happen. It's built in. But we try to balance that out with other areas of things that we don't need. We do have some areas of growth where we are anticipating needing to move some of our expenses from, say, personal care standard, just regular personal care, to, as Karen mentioned, we have extreme growth in our protective service. That is unfortunate that that is what we have going on, but those individuals need unique services and supports immediately to take care and address those risks. Sometimes we are paying for short-term housing for them. We may need to move them. We may need to get them some supplies. We may need to do things that are different. And so we have begun to build more into our budget for those areas where we're seeing they're short, they're immediate, they are needed in order to address the current risk. As I mentioned, we have the move to the admin building. I forgot how much rent was. So the county isn't charging us rent. So I do want to make that statement clear. They do not charge us rent. But there were things that come when you are in a building. You have utility costs. There are things like that. And so for about a year, we kind of missed that expense, and now we're trying to get back into that one and get a feel for what that's going to look like. From our revenues, we are receiving through the Pennsylvania Department of Aging American Rescue Plan funding. So I want to mention that specifically from Department of Aging because the county has received American Rescue Plan funds. Those are two different types of funding, meaning one is to the county, one is specifically to us, and ours comes with additional Department of Aging restrictions on how we can use it or cannot use it. And it's spread out over 3 years. And so we are hoping to continue certain aspects, such as our Senior Connect with that funding. That is something that we would not have otherwise had the opportunity to do previously, and it is having an impact. And so we want to continue to do that. The other thing that changes with our revenues that we can or cannot affect is the interstate funding formulary. So when I say the interstate funding formulary, the federal government provides to the Department of Aging a certain percentage of the money for their operating and for our services we provide to seniors through the Older American Act. One of the things that has changed, and it's a plus, and it's been a plus for us so far, has been that the interstate funding formulary is looking at census data within the counties, and so there have been shifts that were made for the first time in approximately 15 to 20 years in the funding formulary. The challenge with that is that funding formulary is being adjusted every year. So we don't know and won't know what our numbers look like and whether or not we're going to have an increase or a decrease until the new funding program directive comes out sometime between July and September, after we have already started the state fiscal year. So that can have its own anxiety-provoking piece of whether or not we're going to be where we were, or are we going to be higher, or are we going to be lower. We're ever hopeful because the senior population is continuing to grow in Bucks County that we will be positively impacted. We did have a positive impact in the amount of federal portion of our aging block grant that we received with the adjustment they did last year. So we are hopeful it will continue that way. And I think that's all I have. Thank you.
One-handed.
One-handed. I didn't
even drop it. So I know we're almost at 11 o'clock, and so I do apologize for that, but I just wondered if there are any questions or comments. I don't know if there's been anything in the chat, how that's getting communicated to us, but if there's anything on that, anything that there are questions for folks that are here in person. So there's nothing in the chat at this point, guys? No, okay, great. I really would like to remind you about filling out the survey tool, mainly because there's some information about that will help guide us next year when we do our public hearing, but also, again, what are the needs out there in the community that you're seeing? What are the challenges? What are some ways that we could be more responsive to seniors? So, again, if you're in person here, we have it in paper, but if you're in virtual world, there is a form that you've been sent or a link. There will be, I'm sorry, it's going to be sent to you so that you can fill out that survey. So when you get that link, those of you that are virtual, it's not a scam. We really are just looking to ask you to fill out the survey tool for us. So greatly appreciate that. Whoops. So again, I want to thank you all for coming. This is my contact information, so if there's something additional that you either want to email me or ask questions about, please feel free to do so. Again, I want to thank all of you for attending, and I want to thank the team for providing you with such a wealth of information about our services. And I hope you have a very good week. So thank you so much.